Hello, once again. Welcome to my health talk show. Today, as we keep on educating each other as we always do. My name is Dr. Simo, and today we want to talk about some of the conditions, or other medical conditions that basically bring a lot of confusion among people. Sometimes they present with similar symptoms or similar signs, and many times they're confused of which one is someone is suffering from. So today we want to talk about basically three conditions called gastritis, then another one called peptic ulcers disease, and also another one called H.Pylori, also a fourth one called gastroesophageal reflux disease. So these are the four major conditions that basically represent or rather present with similar symptoms, and many times it's confused of which one somebody is suffering from. So I'm going to define each of them and then we shall see some of the main symptoms that exhibit between or rather among those four conditions. So basically we shall start with a condition called ulcers. So when we talk of ulcers, here we mean an ulcer is basically a wound or a sore that can be any part of the body. But now when we talk of ulcers, many times people experience some pain on their abdomen, especially on the upper part. And then most of the time they always say they have ulcers. So when you talk of ulcers, as I've said, those are wounds or sores that can happen in external surfaces or internal surfaces of the body. So when it comes to ulcers, we do have types of them. We do have what we call peptic ulcers, and we do have what we call gastric ulcers. So as we have said, an ulcer basically is where when there is a wound on the internal or external surface of the body caused by a breakdown or a break in the skin or mucous membrane which fails to heal. So when that one happens, it brings about what we call an ulcer. So an ulcer of the stomach is basically called a gastric ulcer, as I've already said. An ulcer in the duodenal area of the stomach is called a duodenal ulcer. Also, a peptic ulcer is an ulcer that develops in the lining of the esophagus. So when we talk about those ulcers, the types of ulcers, as I've explained there are those two or rather three types: duodenal ulcers, peptic ulcers, and gastric ulcers, depending on which part of the stomach that ulcer happens. So ulcers in the stomach basically comes as a result of damage in the lining of the stomach digestive tract. Some of the common causes of these ulcers include bacteria, especially the H.Pylori. Sometimes it can be caused by anti-inflammatory medications. Basically, the NSAIDs, we call them, can also cause when they are used for a long-term period of time. So that's what normally about the ulcers. We go to a second thing we call gastritis. So gastritis basically is the inflammation of the stomach lining. So we have seen ulcers, what it is, and now we want to see what is called gastritis. It's just an inflammation of the stomach lining. So basically when we talk of an inflammation here, we mean when there is sometimes the lining is irritated by different agents that can cause such kind of an inflammation. So most of the, or rather the main symptoms of gastritis normally is stomach pain, nausea, and vomiting. So basically when you present with those kind of symptoms, basically it can indicate that you could be having gastritis. So now having talked about that, we want also to look to another thing called H.Pylori. H.Pylori is a short from Helicobacter pylori. This is a bacteria basically that causes infection of the stomach. So when we talk about H. pylori, here we mean Helicobacter pylori, which is a bacteria that normally affects or causes infection of the stomach. It's the main cause of peptic ulcers, as we have said above, and it can also cause gastritis and even stomach cancer. So, as we have said, these conditions may present with similar symptoms, but it's good that we get to know the differences. So basically, the main symptoms of H. pylori will also present with similar conditions like those, or rather similar symptoms like those of gastritis and even peptic ulcers. So it will include stomach pain, nausea and vomiting, and as well as a lot of discomfort. Sometimes some people even end up getting diarrhea and the likes. Sometimes others get heartburn and the likes. So, but the most common symptoms is burning sensation and pain in the middle of your abdomen. So basically, when you present with that kind of pain, it may indicate you could be having this infection. So the pain basically happens on the middle part of the chest. Sometimes you may even confuse it with a chest problem. So basically, that is the typical symptoms of H. pylori. So sometimes the pain will be more intense when your stomach is empty, and the pain is relieved when your stomach has some food. Also, an antacid sometimes you may take, and it may relieve that kind of pain. So with H. pylori symptoms are also similar. You have also experienced the same panning sensation, in your abdominal pain, that is once when your stomach is empty, nausea, loss of appetite, frequent pumping, bloating, and intentional loss of weight. So most of the time, gastritis and peptic ulcers present with similar symptoms. Many times they end up getting a confusion of the two conditions. Then lastly, there is a condition that I've just mentioned called gastroesophageal reflux disease. Sometimes some people call it Gerd. I might add, depending on how you may want to pronounce it. So gastroesophageal reflux disease, this means there is a reflux of the stomach content, the acid in the stomach that leaks upwards. Then it causes some of the symptoms, including even sometimes a heartburn. Sometimes they may even present with an irritation even to the throat. Some people may even cough. Others may just even suspect they could be having issues with the chest, when actually it's just a reflux. So when we talk about these things, these symptoms, it's always good that you get to know what could be the main condition you are suffering from. So we always advise that when you have those kind of symptoms, always see a doctor, and also get to explain the symptoms, get examined, do some tests, basically the likes of a H. pylori antigen test to rule out H. pylori. Sometimes we may even advise that for those ones who have very severe symptoms, they do tests, or rather imaging, the likes of endoscopy to rule out some of the ulcers and also the Gerd. Sometimes some people may present me with even vomiting blood, or rather vomit which has blood stains. We call it hematemesis. So all these kind of symptoms may also show that you could be having either of those conditions. So my take-home point is that try to find out what you're suffering from. Most of the time, people just take medications, maybe antacids, PPIs, which eases the symptoms, but again, the symptoms comes back because maybe you have not treated the main cause. So see your doctor, get proper diagnosis, so that you are able to know what you're being treated of. Thank you for listening, and thank you for your time. As always, I tell you, health is wealth. Let's keep on educating each other, and let's keep on engaging each other. Follow my platforms, my Facebook page, Health is Wealth, my YouTube channel, Simon Dominic, as we keep on supporting each other. Thank you, and may God bless you.